Good afternoon. I'm joined today by Commissioner Fuller from New South Wales Police and Brigadier Garraway from the Australian Defence Force to announce the increase in capabilities from the Australian Defence Force as part of the nationwide Operation COVID Assist by the Australian Defence Force. What we will see from today are 300 ADF personnel assisting with police to ensure there is maximum compliance when it comes to the current public health orders. This is not something the government wants to do. It's something that the community needs to happen to ensure that we reduce the spread of COVID-19 and get our lives back. I'm delighted that we're going to be able to be seeing the support from the Australian Defence Force in a whole range of roles that have been occurring in other states around the country. There is nothing new in this. There is no need for anybody to be concerned. This is a normal defence aid to the civil power protocol. These protocols have been around for decades. We've seen them used currently in other states. We've seen them used with the operations down at the border closures in Albury. We've seen them used during the bushfire season of 2019-20. There is no need for anybody to be concerned. This is still a civilian police-led operation, and of course the police-led operation is responding to the rules set out by the democratically elected government. There is no need for anybody to carry on as if this is some sort of move away from the government's response to COVID-19. We're just very, very lucky that we have 300 Australian Defence Force personnel who are in Sydney that are able to assist us. Brigadier Garraway will talk about the deployment, but there certainly will be a mixture of reservists as well as regular ADF personnel. They will be working right across Sydney. No one suburb will be targeted. There will be ADF personnel deployed alongside police right across the city. The personnel, the ADF, will also be working in supportive roles to ensure that meals are delivered, to ensure that the police are supported in areas where they can then redeploy their assets to ensure compliances across the city are maintained and met. It is going to be a 6-week operation at this stage. I'm very, very hopeful that we can bring that forward. I'd be delighted if we could shorten that 6-week deployment. But of course, because we're very lucky to have such an agile Australian Defence Force and they work so well with the New South Wales Police, if that does need to be extended, unfortunately, there will be an ability for us to do that. At the moment, it's just those 300 ADF personnel. They'll be working alongside 17,000 police right across New South Wales, but obviously based in metropolitan Sydney. And we are, again, very delighted that this can occur. But these are established working protocols. There is nothing unusual about this operation. And of course, if it's going to mean that we can get our lives back and we can shred those public health orders and ease the city of its restrictions, well then I think the community will agree with it. I'll now hand over to Commissioner Fuller and then we'll hear from Brigadier Garraway.
Good afternoon, thanks Minister, and thanks Mike Garraway, Brigadier of the Australian Defence Force, for joining us. Mike and I have been working together for nearly 2 years now, and that partnership started when the bushfire season started all the way back in 2019, and neither of us thought we would be here today, but nevertheless COVID continues to provide many challenges, and the Delta variant probably has been the greatest challenge for us. Last Thursday I made the request through to the Prime Minister, through the New South Wales Premier, for defence assistance. It's actually an expansion of the current defence request. We have Australian Defence Force currently working in the Police Operations Centre doing logistics and planning, and of course in the hotel quarantine operation. We've seen them in place since April last year, and those who have worked or come into the city would have seen defence on and around our hotel system in the CBD. Now, why the request last Thursday? With the COVID numbers being around 200, if you think about 200 positive cases, then the work health do with contact tracing, that could be 1,000 doors we need to knock just on today's statistics alone. Now, what to prevent Defence provide and have provided for the last 2 years? Highly trained, motivated workforce who understand logistics, they understand planning, but they also understand that sense of community. So to have them back assisting us over the coming weeks is a great outcome for New South Wales Police Force and the people of New South Wales. And yes, they will be helping with some sense of ensuring people are complying with the health orders, but that could be as simple as making a phone call to a household. It could be dropping care packages off to houses. It could be helping contact tracers. There are a myriad of roles and responsibilities that Defence said they will assist us and New South Wales Health. And what's this all about? It's about getting us out of lockdown as quick as possible. Thank you. Brigadier Garraway.
Thank you, Commissioner, and thank you, Minister, for this opportunity to speak. It's a great pleasure for us to extend the support that we're already providing to the state of New South Wales in the current circumstances. The nature of the tasks that we're going to be performing are supporting the police under the direction of the New South Wales Police Force, and also supporting the Department of Health. I want to say right up front that we're not a law enforcement agency, and that's not what we'll be doing. The tasks that we've got underway today, for example, are delivering food hampers, assisting people with the setup of vaccination stations, and those sorts of tasks will unfold in the coming days. I also expect that we'll be engaging once again with the Department of Health for contact tracing, which is a task we did last year for approximately 3 months. So as the Commissioner said, this is really just an expansion of the tasks that we've currently got underway. I expect that those tasks will develop in the coming weeks as stated. At the moment, we have approval for up to 300 people and for approximately 6 weeks. But that's the upper figure, and hopefully that's as long as it will take. And as soon as the operation is concluded, as soon as we are no longer needed, we'll step back out of the background and let the state do what the state does best. But I just want to stress up front once again, we'll be under the control of the New South Wales Police. We're not a law enforcement agency, and we'll be doing tasks that are supportive in nature. What you've got with the Defence Force is a disciplined, capable organisation that's vaccinated, that's tested, and it's compliant, and it's able to do a range of tasks that will take the pressure off the police, take the pressure off the Department of Health and other organisations, so they can get out and do what they do best. That's all I have. Thank you.
Questions?
No questions.
Yeah, so at this stage, the vast majority have had their 2 vaccinations. I will have a small number of people by virtue of the timeline who may not have had their 2nd vaccination. And if that's the case, they'll be doing back-of-house tasks, so that anyone in any front-facing task, for want of a better term, will be fully vaccinated. They'll be wearing full PPE. They'll be swab tested as a minimum every 3 days. They'll be temperature tested regularly. So as I said, you've got a healthy, compliant workforce. Yeah. Look, I can understand those concerns. Last night I had a 60-minute Zoom meeting with the New South Wales Imams Council, for example. So, we're reaching out to cultural groups just to make sure that they understand exactly what we're doing, and importantly what we're not doing, and what our role is. So thanks for your question, but I think we're covering that. So we're only in a supporting role. So there won't be an occasion in the vast majority of circumstances where a soldier, a sailor or an aviator has to engage directly with a person on the street. That's just not what we're doing. We're in a supporting role only under the direction of the New South Wales Police.
Oh, it's not about being stretched, but it's about making sure we don't get stretched. And there's no point throwing your hand up when there's no point throwing your hand up when it's too late. And obviously the numbers had been high for about probably 7 days, and forecasting the sum of contact tracing was a huge task for health and police. So it was about putting up the hand that we need assistance before we got stretched. No, there wasn't, but one of the ideas about announcing this Thursday but not rolling it out till Monday afternoon, which meant it gave us 4 days to really get out and saturate the message. Today this message is going out in 4 different languages, interpreted as you ask me questions. You've heard some of the community contact that Defence have done. New South Wales Police has done the same. We're certainly not about trying to put fear in the communities at all, and we'll be testing the temperature in relation to that, taking feedback daily. But it's our intention that we will spread those officers right across areas such as with vaccination hubs where they need support with traffic management. They could be making phone calls, helping contact tracers. They're helping us today in the Police Operations Centre. They're not all going to be out there door knocking. I think it's important that the community understands that the support is much broader than that.
Richard, do you think that police enforce COVID rules equally in the United States to the western suburbs?
Look, the great challenge with the enforcement of the health orders, particularly on sunny days, is that we see big numbers at our beaches, and that causes community concern, not just in Western Sydney, but I get more complaints about the beaches and the numbers of people on the beaches than I do about any other single health order breach. I can assure you we're policing the health orders equally across the state. Obviously that makes it complex when regional New South Wales has a different set of health orders. I know there's 8 LGAs of concern at the moment, and they have more rigid orders there at the moment. But the sum of our activity is about getting us out of lockdown as soon as we possibly can.
Commissioner, there were large numbers of volunteers yesterday, and there were actually police there not seen handing out fines. When exactly do they go in and hand out fines?
Look, from our perspective, we are out handing fines every day. On Saturday, we gave out hundreds and hundreds and hundreds of fines, and in fact, we were pretty disappointed in terms of the general compliance right across the Sydney metro area. I know it was a beautiful sunny day. I think to a point we're complacent in Sydney because we have had a good run over the last 18 months, but the Delta variants, I just don't think some people are taking that seriously.
Well, they're the landlords, so the public health orders say that it's the landlord's obligation to comply with the public health orders themselves. But it will be more of the same. If we just have to keep taking police down there and issuing fines, we'll do it. And my appeal to the mayors is that there's nothing special about the eastern beaches. You can get COVID there as well, and in fact we've seen plenty of it. And to the people that live around the eastern beaches, instead of congregating at the beach, just do what everybody else in metropolitan Sydney is doing. When you're going for exercise, walk around the block. Well, first of all, I'm comfortable that the community leaders understand exactly why we're doing this, and that's why we're here right now, to explain to the community that in Australia, the Australian Defence Force works for the elected government, and just like they helped us during the bushfires, they're helping the police during COVID-19 when it comes to compliance and delivering food and all those other things that are required by government. I this morning briefed all of the MPs from Western Sydney, who both Labor and Liberal, and they understand completely what needs to be done. My appeal to certain community leaders, and a few mayors have been spreading misinformation, is to understand exactly what this is about. This is about making sure their local residents get out of lockdown. There's nothing more about it other than ensuring that we get compliance, maximise compliance, and we get people out of lockdown. My appeal is to anybody that's got questions is contact your local member, because I've briefed them all, and look at the public health orders and see exactly what their obligations are, because the Australian Defence Force are here to provide us with the support to ensure compliance. And don't underestimate the community's affection for the Australian Defence Force either. I mean, they are very, very grateful that they are here making sure that we keep safe. And I think you'll probably find that those people that you refer to that are locked down will probably be more likely to be grateful that the Australian Defence Force is here to provide that extra surety and reassurance, and we'll get them back to the pub quickly.
Richard, if I could just follow up with the question I asked earlier. I got some numbers from the police force the other day. I asked for where the pins had been issued in the first 2 weeks of the lockdown, and I compared the eastern suburb and the city, which was the original lockdown zone, with the police commands in the west. There was more than twice as many pins issued in the west before the high visibility operation started. And is there a good explanation for that? Why is there so much more enforcement in the west than the east?
Look, I haven't seen the stats on that, but obviously the first phase, particularly when the lockdown started, there was a greater police presence in south-western Sydney. That has spread now, particularly over the weekend. We saw many more tickets in Sydney and along the beaches. So you will see that change move depending on the movement of the community, but there's certainly no intention of enforcing health orders in any one particular area, because we know workplaces are one of the primary places that people are getting the virus, and then they are taking it home. Then it's home-to-home transmission, and that's why this operation is about making people are staying home, particularly if you've got the virus or you're a close contact.
Could either of you tell me where the army personnel will be stationed? Have you divvied up which numbers, how many numbers?
That's right. You want to?
So what we'll start off with is the majority of troops based out of Holsworthy. We've also got barracks at Randwick for assistance that may be needed in the eastern suburbs. We've got other depots at Dundas, Orchard Hills and places all around the city, so we'll adjust our footprint as we need. I alluded to that control that we're able to achieve, so we'll have soldiers, sailors, aviators on a specific task. So they'll deploy out of their barracks into a location for a specific task and then go back to their barracks again. And they'll do that repeatedly, so we're able to segregate our workforce. It also means that they're not unnecessarily crossing lockdown areas, so we, as far as reasonably possible, decrease the opportunity of becoming a vector ourselves. And that's the way we'll stay. If other suburbs become locked down and we need to shift our effort, well, then we'll shift our footprint. And as I said, we may end up with troops stationed out of Orchard Hills or Dundas or other places like that. But for the moment, the majority will work out of Holsworthy in a highly controlled manner.
And each day they'll get an assignment for which?
They'll know their assignment a couple of days before. So they'll know exactly where they're going to, exactly what their roles are, who they're reporting to. And once that job's over, they'll come back to the barracks again.
So there's no way for the community to tell on each given day if there's going to be troops in their area, or that'll be?
No, and I would suggest that there's probably no need to. When we're doing tasks like delivering food parcels, when we're assisting with the establishment of vaccination hubs and other measures like that are entirely supporting the community and supporting the effort, I actually wouldn't see a reason why you would need to know.